Are you wondering what to look for in your child that you might see that there's something going on that a chiropractor can help out with? I'm Dr. Jen Anaker with Anaker Clinics of Chiropractic. You know, in our office, we really see a lot of newborns that are just hours and days old, and then of course on into older years. But here are some of the things that I teach parents, I teach providers, that you can look for in your children. And a lot of parents see it in their children, and so they come in telling me these types of things as well. So here's some things to look at, to think about as to what to look for and what chiropractic can help out with. So one to look at is positional. Is the child's head off to the side, and is there a tilt? Maybe there's a shoulder tilt along with it. Maybe even just looking at your baby and the stomach is deviated off to the side, or it looks fuller off to the side. Maybe the hips are wanting to twist. Maybe when you put your child on tummy time that they don't like it, they don't want to lift their head up. That can oftentimes be something going on in the neck, and so that's something to look at because tummy time is really important for the nervous system development. So that definitely pay attention to that. And sometimes too, you know, you might see it right away, or you start to question, gosh, I wonder these positional things, how long have they been going on? Maybe look back into older pictures of your child. You might see that some of these things, you know, again, started on day one. Maybe you see things like the baby snorting or constipated, gassy, not feeding well, favoring one breast over the other. That can tell me a lot about the ability of the baby to turn their neck. Maybe they're not sleeping well. Maybe right after that birth you noticed that there was a lot of bruising on the skull, or the shoulders got stuck. Maybe there was a positional challenge during the birth. And, you know, all these things, there can be multiple things that might be going on. So as a chiropractor, our first thing is to make sure that we can help your child with any particular symptom. But these are things that we see in our office. And the way that chiropractic can help is because we look at the nervous system. And the nervous system helps from the brain, the body, and then goes out to every organ and gland in the body to make sure that it's communicating, it's functioning, your baby's healing and repairing. And that way, it just creates the healthiest version of your child possible. So those are some symptoms. I will tell you, on the other hand, I see a lot of little ones that don't have any of these challenges, but the parents want their kids to get checked. I call that the reset adjustment right after the baby's been born, so that way they make sure again that the child is as healthy as they possibly can, leading from the first days on forward.